Hi, thank you for everyone that just joined. We're going to give it a minute or two as people are still joining our meeting, and we will start shortly. So welcome, and thank you all for joining us in our Versatility in Uncertain Times Tips, Tools, and Resources webinar, where we're going to be hearing from partners serving clients remotely. I am Marquita Robertson, the Executive Director of the Collaborative, and I will be facilitating the webinar today. The Collaborative is a statewide nonprofit whose mission is to close the racial wealth gap in North Carolina by ensuring that everyone has a pathway to prosperity. Before we get started, we are going to go over some housekeeping rules or some housekeeping announcements. This webinar is being recorded, and you're going to be muted until it's time for Q&A. And you should also use the Q&A chat feature at the bottom of your screen to ask questions if you're having any technical issues or if you have any questions of our panelists. So we are hoping that you get to make the most of this webinar today. And to do so, we encourage you to find a quiet space to get a snack and to engage. Converse with us during this webinar. Send us your comments, any questions that you have, and reflect on ways that you can take the information and the insights learned today and apply them to your own work. And we are going to get started today with a poll, and then we'll set the stage with a bit more context about the webinar and the conversation we'll be having today. We're going to hear from our partners. We'll have an opportunity for questions and answers. And then we'll have an opportunity to hear from you, our audience, to share your best practices. And we'll give you a preview of upcoming webinars and close out our day. And so let's get started with our poll questions. So this is going to give us a better idea of who's on the call. And so our panelists can speak right to you. So you should have a poll in front of you. And the first question is, what best describes your organization's COVID-19 work plan? Considered an essential business. Most staff are reporting to the office to see clients. Transition a majority of our work and are able to serve clients remotely. Unable to transition to remote work, and most staff have been furloughed. And there's an option to select other. If you have an other, please share details regarding that in the chat feature. All right, and so we're going to go ahead and close that poll. And it looks like most of the folks on the call were successfully able to transition a majority of their work to serve clients remotely. Some of you are considered an essential business and are still reporting to the office to see clients. So thank you. So our second poll question is that up on the screen yet? The second poll question is, what is the biggest challenge that your organization has experienced during this time? Is it resources, funding, technological issues, developing a responsive strategy, or issues with clients' access to remote services? And there's an option for other. And if you have an other, please share that in the chat feature. And we'll give you a second to finish completing that poll. is still moving. And we can go ahead and close that poll. And it looks like most of you are have issues with, the biggest challenge with issues with clients, access to remote services, and then developing a responsive strategy, followed by resources and funding and other issues. So thank you for participating in our polls. That gives us a better idea of who's on the webinar with us today. And now we're going to move into our panel discussion. The COVID-19 pandemic is more than just a health crisis. It has a ripple effect, and it has all of us our work. As the world responds to this new threat, many of us are struggling or have struggled with how to help our communities while also trying to endure the crisis ourselves. Today, we have the pleasure of hearing best practices, lessons learned from 3 of our partners representing various bodies of work from different regions of our state who have pivoted and transitioned their work and their services. So we'll start with Liana Humphreys, one of our panelists, and they will all tell us about their organization and how you pivoted during this time to serve your clients and the impact that it's had on your work. And I will kick it off to you, Liana.
Great, thanks, Marquita. So as Marquita said, I'm with Crisis Assistance Ministry. I'm the Chief Marketing Officer there in Charlotte, North Carolina. And for the past 45 years, Crisis Assistance Ministry has been the financial emergency room for Charlotte. It's a unique model where we act as the leading agency for Mecklenburg County and manage 6 different public and private funds and serve as a one-stop shop for basic needs. So in non-COVID-19 times, nearly 200 families a day visit our facility for emergency rent and utility assistance, as well as to shop in our free store or furniture bank and to participate in financial coaching and counseling to help them achieve greater security. Back in March, when the North Carolina courts closed and utility companies stopped disconnections, we really thought that this would be a little breather for people facing unemployment or unexpected expenses due to COVID-19. And it seemed as though everyone would be able to experience some temporary housing stability while sheltering in place. But what we quickly realized was that these protections were not being applied equally to all vulnerable populations. And specifically, thousands of families across this community who call hotels and motels their primary residence were being kicked out for non-payment. Crisis Assistance Ministry was asked to put together a stopgap solution to prevent these thousands of people from being turned out on the streets in the middle of the stay-at-home order. And we partnered with the United Way and 211 to create a 24/7 hotline and started making payments directly to hotels to keep families stably housed. Simultaneously, we engaged our partners at Legal Aid and have been working to educate hotels and motels about North Carolina tenant-landlord laws. Turns out that residents for whom a hotel is their primary residence are actually protected under these laws. And if a hotel wants to evict for non-payment of rent, they have to go through the court system just like a landlord. The Attorney General actually got involved and on April 4th sent warning letters to over 100 hotels in Charlotte, informing them of these consumer protections. And since then, evictions have slowed down considerably. And to date, we've helped more than 1,300 families in over 50 hotels avoid homelessness. Just in the last couple of weeks, the Homeless Services Network has been able to take back responsibility for working with these families who by many definitions are considered homeless. And this has allowed us to focus again on our core mission of providing rent and utility assistance.
Back to you. Thank you, Liana. Thank you for that information and for the amazing work that's happening at Crisis Assistance Ministry. And we'll get a little more into it in a few minutes, but first we'll hear from Jermaine McNair from NC Civil. You're on mute, Jermaine.
Yep. Technology. We're with it though. Good morning, everyone. My name is Jermaine McNair. I am the founding and executive director for NC Civil, which is a local community-based nonprofit that's serving in Greenville, North Carolina, which is in the eastern part of North Carolina. Our work focuses on community outreach and partnership development for capacity building in our local distressed areas. And our mission is for the long-term development of community-based institutions and the growing inclusion of the populations who are traditionally excluded from public spheres and spheres of power. This is a strong focus on systems building and indirect services rather than direct services to specific clients, and based on a philosophy that how those partnership systems, how our institutions, agencies, and community members work together actually creates the way a community functions, or it drives disparities when that work is broken up. Post-COVID, we were doing some, I think, amazing work with our local institutions and local organizations to kind of reshape the way we do business as a community. For example, we were working with our major health system, who is also our largest area employer, on a workforce equity initiative that allowed us to bring together many of the different agencies that were focusing individually and in their separate silos on workforce development, but to bring them all together to create what we call an every door is the right door policy, building referral management systems between these agencies that could help support job seekers from training all the way to living wage employment, and then working with our area's largest employer to redesign their application process to remove barriers. We have similar ongoing initiatives with our local law enforcement, helping them redesign the way they do the business of law enforcement in our community to help each of these institutions and organizations move towards more community-centric models, and us being sort of those outreach and partnership development guides for many different initiatives in our community. But again, I just want to note that that is capacity building and indirect services versus direct services. And I think that's important because once COVID hit, I think we focused on the response strategy aspect of it, and just recognizing that whenever there is large scale community tragedy, whether it be natural disasters or some other kind, you get a level of response activism that basically you get what we call overnight activists that spring into response mode kind of overnight, and you have all of these initiatives happening. And one of the things that we greatly work against in our communities is fragmentation of efforts. So one of the ways that we kind of pushed our response strategy was to kind of step back and move into more of a facilitator role to support that response activism, because we believe it is a good thing, but to keep it away from getting into fragmentation and poor coordination, which oftentimes fails to account for gaps in resource delivery. We began to coordinate with our local and county-wide agencies. We formed a county city COVID relief task force to increase the speed of information being shared between leading agencies and organizations. We transition our outreach into developing no contact outreach methods, leveraging social media to work with social influencers to drive circular engagement and just create verified messaging that could move through to our community, and most importantly, to our most hard to reach populations. Within that, we launched a media project with our local health system and local independent media groups, working with those social influencers to create or reappropriate verified content to make it more digestible for our marginalized communities, because we realized that information was just flowing at our communities from every which direction. There were political arguments that were presenting information from every different aspect, and we believe that to be overwhelming to community members. So what we wanted to do is channel verified content into our most hard to reach populations and leverage the social and community influencers from within the groups to become carriers of that information to make sure that it was getting to our community members. We went on to produce weekly community panels that would bridge the gap between our major institutions and information providers and those hard to reach communities. We engaged on smaller projects, created fundraisers and community feedings, which allowed us to leverage those tools for people who self-identified as being in need, but using that as a method of doing direct check-ins with those families. We did several other things, all online. Community check-in tools, I think, was a big one that was basically this community check-in tool that we developed that asks 6 basic questions, and it could be sent out via text message, via social media or email, or even, on the phone call, that asks 6 basic questions of every person. Do you have enough information that's necessary to protect you and your family in regards to coronavirus and COVID-19? Do you have enough basic food and supplies to remain safe at home? In the event that you experience a shortage, do you know what organizations or agencies to connect for relief needs? If you experience unemployment, do you know how to navigate systems of employment and related resources? And if you have kids in the home, do you have access to digital tools necessary for home learning environment? And that allowed people to self-identify, and if they needed a call back or wanted someone to reach out to them, we could patch that specific question and specific need to the proper agency and transition our outreach that way. There are several other things that we did, but it all kind of fits into that response strategy transition mode.
Wow, that's pretty impressive. Thank you for sharing that, Jermaine. And we'll talk a little bit more about your no contact outreach and your other things later. But now we'll hear from Lisa Terry from Financial Pathways of the Piedmont. And you're muted, Lisa.
Okay, there we go. So good morning, everyone. Thank you, Marquita, for inviting me to be on this panel. I really do appreciate it. I am Lisa Terry with Financial Pathways of the Piedmont, the Director of Financial Management and Education. So essentially, I oversee the programs that are all kind of non-housing related. So the budget and credit counseling, student loan debt counseling. We have a great program for seniors, for our aging population, senior financial care. Financial Pathways of the Piedmont is a United Way agency. We are a nonprofit agency, and we're essentially a consumer credit counseling agency, and that's actually formally what our name used to be. But we did change our name to Financial Pathways of the Piedmont several years ago because not only do we provide some of those services, but we also offer so many other programs, and we're a very unique agency in the programs that we offer, along with the various funding sources that we are fortunate to be a part of. Our mission is to basically try to improve, help, guide people to improve their financial well-being. We do that through counseling, coaching, and financial education in the community. Obviously, through 2008, through really not too long ago with the housing crisis, we were very busy with the foreclosure prevention program. And of course, North Carolina was a hardest hit state. So we were a participating agency with the mortgage payment program. Unfortunately, or fortunately, because there are so many great resources in our area, we're seeing a lot of similarities to what's happening now to what happened then. And I think that even the experts will say the same. And of course, just like I think Jermaine indicated, normally when there's ever a crisis, the marginalized continue to get marginalized even further. They're usually the ones that are higher at risk, the ones that are taken advantage of, the ones that are at risk of threats, scams, fraud, evictions unnecessarily. And so not only do we provide the counseling services, but we also are an agency that advocates, refers, works with many agencies in our community so that we can try and protect those that may not have resources or knowledge. And with the knowledge overwhelming, just overload everywhere, making sure that people are getting the accurate knowledge, the correct knowledge, and not based on one political party or another political party, or but that it's accurate information so that people can make the best possible choices. I actually started this agency 17 years ago, and I have been in this leadership role now for a little over a year, and what a year it has been. But I am grateful to be here, and I look forward to talking more about how we've transitioned to remotely working from home.
Sounds good. Thank you, Lisa, and thank you all. I'm sure our audience will agree that there is a lot of work being done across the state, and you three have really lifted up some great work that's going on. So thank you for what you're doing. So I'll continue with you, Lisa. What are your, as you guys, March 13th through 14th, 15th, we were kind of iffy about what was going to happen, what the governor was going to say. what were some things as you guys started to plan, as this became real, that, okay, we're going to have to figure out a new way to do business? What were some things that you discovered or that you had to consider as you were putting your plan, your strategy, what we're going to do as you were putting that together?
Well, and that's the thing, it happens so quickly.
Yeah.
And I'm already a person that does not watch the news a lot just because the news is so depressing. And so, you know, I heard the hubbub, of course. My daughter works in an essential position in a retail store. So she would come home and tell me all kinds of crazy stuff about the toilet paper and all of that. And I was still going to the grocery store and I noticed that the paper products were gone, but you know, whatever people, I was one of the cynical people, unfortunately. Some of my leadership and my CEO, they were very serious about this. And so one of the biggest things I think that had to happen immediately was we all had to get on one accord. Whatever our individual beliefs may have been, or what we thought or what we didn't think, we had to realize that there's still a whole community of people that were terrified.
Yeah.
And just for the record, I am totally on board now. I had my own little mini meltdown at a grocery store like the week before everybody went home, and I went in the grocery store and like everything was gone. Like the meats were gone, the canned goods were gone. And I think I was so scared that people were scared. I think that was what was so weird, was that, you know, there's a lot of frightened people and fearful people out there. And then I just kept thinking about, you know, I'm fortunate and blessed. I still get a paycheck every pay period, and there's going to be so many people that won't. And again, the marginalized that are already struggling, barely making ends meet, their jobs have just been taken from them because they can't work. So we had to all kind of get on one accord and realize community-wide what the impact was, not necessarily on an individual basis, but be able to count your blessings at the same time. So I mean, March the 13th, my CEO wanted to have an emergency leadership team meeting. We met in the conference room, spaced apart. And by that following Tuesday, we decided that the office was going to be closed to the public. All staff were to stay in their offices. All scheduled appointments were going to be strictly moved to the telephone. We had some program clients that thought, well, you know what, I'm just going to reschedule. This will be over in a couple of weeks. I'd rather really just meet you in person. And we kind of let them reschedule there for a minute, but then we realized, you know, we need to go ahead and stay in contact with these people because we don't want to lose them. As we all know that serve the community, if you lose that opportunity to have them right there with you, the chances of them coming back decrease. So we wanted to make sure that people didn't lose their momentum or their drive in seeking the services that they needed. So by March the 17th, we were working in the office, but like I said, we had to stay in our offices. We were doing phone counseling sessions. A week later, we had that 1 week time span because everybody was saying it's coming. We're going to end up working from home. And I still wasn't quite believing it yet, but we were able to transition everything technology-wise. Our IT person, God bless her, we had to figure out ways to get everybody to be able to connect remotely from home, for one. And when you deal with licensing issues, the ability for bandwidth for folks to all log in at the same time, we had to do 2 different ways of getting people logged in so that we didn't exceed certain licenses or bandwidth. And we still have one program that is essential and has to still come to the office, our representative payee program. You know, they serve over 400 clients, and they are the most vulnerable Social Security benefit recipients with chronic homelessness, mental health issues, substance abuse issues. So those folks are the most vulnerable. So our staff had to continue to come in to process their monthly bills and weeklies and stay connected with them so that they also would feel safe knowing that we were still here to serve them. You know, ironically, in that week's time, we were able to get pretty much everybody lined up to work from home. And by the 17th, everybody started working from home, and we still are to this. You know, we have some admin staff that have to come in sporadically just because we have to check mail. There's certain essential things that we need to do, deposits, things of that nature. But for the most part, our counseling staff are working from home remotely by telephone.
Wow, thank you. Thank you for sharing that, Lisa. Very interesting. And you mentioned issues with clients being a little reluctant, or some of your clients being reluctant to opt for the remote services. And we'll talk about that a little later, because that was also something that our panelists were very interested in as well, too. So I'll move to Jermaine. And Jermaine, what did this process look like for your organization? It sounds like you guys are pretty responsive. You put together this really engaging, platform for people to be able to get better information, to feel a little more empowered. But what did that process look like?
Yeah, well, I think first off, we were already pretty remote capable. We're not the largest organization, so at the time when COVID hit, we were managing again as a grassroots organization 4 Vista workers, 2 interns, and then 4 standing subcommittees that each manage community volunteers. And really only 2 of those standing subcommittees engaged in direct community related like outreach work. So all of our committee leaders and vistas and other folks that worked in our office each already had their technology equipment. We did have to upgrade our services to make sure, I think as Miss Liana talked about, to make sure that there was enough bandwidth and enough kind of room accounts for everybody to engage in a single setting. But we were pretty much already geared up for that. I think the biggest transition for us was kind of expanding our network and assembling first and foremost with different leaders from around our city and county to make sure that as resources and activities began just flying every which direction, it's how are we positioning ourselves to create that kind of war room mentality, whereas whenever there's a crisis, you have to make sure that you're sharing information extremely fast, right? So you can monitor what each agency is seeing within their work, what needs might be arising through the lens of every agency, and then what actions might we be able to coordinate to meet those needs. So we got together with our local United Way, our city manager, our county manager, a few other agencies, food resource agencies, housing agencies, and we quickly put together an initial response task force to begin sharing information. In that way, that gave us the ability to have a stable platform so that as other people bring resources to the table, because we're talking about just community members seeing a need, stepping up and being able to raise substantial dollars right in our local area, but may not have the guidance on how to best administer that programmatically, right? And being able to support them. So again, we created those task forces, and then based off of the information that we was able to draw from the task force that we assigned ourselves to, if you will, we saw that there was going to be a need quickly with those marginalized populations, and as those resources got distributed without the skill and the guidance, that the most vulnerable were probably going to be left out, because most people deliver resources in their warm markets, right? They get it to the people whose hands are closest to them, and we all know that people who experience barriers, those are the people that's going to get it last. So again, that's where that's where the community check-in tool came in. It's like, what kind of mechanism can we develop to send it out through the community and empower other people to transmit it through the community, so that we can capture information about who's being left behind, and how can we then get in and fill in the gaps and let everybody do what they do, but let's focus on filling in the gaps where they are. So it was about that community infrastructure, but it was getting our people home, making sure they were able to maintain their paychecks, and then thankfully everybody that was on our teams are able to continue to draw down a paycheck, assembling with local leaders to make sure that we have our war room established, so we're not just acting without having the proper information, and then taking that information and allowing us to pivot our response and our action in the most effective way for our community. And every other tool that we developed and every other approach that we developed came out of that.
Yeah, no, that's good. That's really insightful stuff. One thing that came up, as I mentioned earlier, this came up during our during the poll, was some of the issues or challenges that people had with this process, and one of them were clients' access to remote services. And Liana, I want to talk with you about challenges. What were some of your challenges, and if you have any insights or perspective to provide to what our audience is dealing with?
Sure. Yeah. So one of the distinctions or the things that we learned, because helping with hotel evictions was not a core aspect of our work prior to COVID-19. We certainly knew that there were lots of families in Charlotte that lived in hotels and motels, and at times we would assist with helping with initial deposits so that they could kind of move into permanent housing. But one of the key differences was, so with individuals who have a lease or a mortgage, especially if they're going through the court process, we typically have days or weeks to resolve a financial crisis, as well as existing relationships with landlords and the utility vendors. So in the case of the hotel evictions, we frequently had only a matter of hours before families were going to be turned out on the streets. And so we had to quickly create a process that didn't exist previously to ensure that these families could remain housed. And our team was working, around the clock, 7 days a week. It wasn't a sort of a Monday through Friday, 8:30 to 5 kind of thing. We were getting calls on the weekends, on Saturdays, on Sundays, at all hours. So within 36 hours of the initial community meeting, where we came together with the county and with United Way, we were making payments directly to families to help keep them stably housed. So it definitely was sort of like a rapid response situation. But all along we knew that we needed to get back to providing rent and utility assistance, which is, the core part of our mission, especially given that the eviction moratorium and the halt on utility disconnections would eventually come to an end. So last week we started accepting requests for rent and utility assistance via our network of over 50 partner agencies in Mecklenburg County. And yesterday we actually launched a new online form where customers can apply directly for financial aid. And with no marketing whatsoever, we had 26 requests in the first 12 hours and another 88 in the last 24 hours. And just expect those numbers to grow as, word of mouth makes more people aware that this new online tool is available. You had asked about challenges, Marquita, and I just want to highlight a couple. One, it was definitely this challenge of balancing our response to the immediate need of preventing homelessness for people in hotels, while also being able to redesign our service delivery model for rent and utility assistance. Preventing hotel evictions drained more than $600,000 from our private funds, which otherwise would have been spent on rent and utility assistance. Thankfully, the communities responded with tremendous generosity and has already replenish that fund, but initially that was a concern for us, just, how are we going to be able to sort of have enough money to support both of these needs. And then in terms of like that virtual service delivery model, many of our caseworkers did not have laptops. We were used to seeing people in person, and they had desktops, but not necessarily laptops that they could use from home, and some had internet issues that we had to address. So we spent more than $26,000 just getting our team set up to work remotely from home. The good thing is once we got everybody set up to handle the hotel evictions, now they were well positioned and it was easy to pivot to the rent and utility assistance. And then the last challenge I'll call out is around the lack of access to technology that can be a barrier for some of the individuals that we serve. So for this new online form, you do have to have an email address, and customers need to be able to submit copies of critical documentation electronically, things such as leases and bills. So we know that this is going to be a barrier, and for some people getting assistance. And so the next phase of planning will look at kind of curbside document drop-off and signing of forms that are sort of essential in order for us to be able to distribute monies. But we know we have to proceed carefully with any in-person interactions just to ensure the safety of our staff and our customers.
I feel like it's coming out through all of your talk and you talk about how you adapted to work with your clients is that it was just, you know, whatever you do, it may be unique to your organization or your clients or your service, but you've all successfully found a way to serve them, if it is the no contact outreach or the drop off, or just serving them remotely. And I think that speaks volumes to your commitment to the work that you're doing, and applaud you all for that. Thank you for that, Liana.
No, thank you.
So we're now in the first phase of reopening our state. And I'm wondering, have any of you guys had conversations about what your work will look like going forward as we continue through this process? And I'll see if Lisa can help me out with that one.
Sure. So we have kind of drafted what a phase 1 of reentry would look like. And because a lot of that, of course, is up in the air based on kind of what's going on in our community. Like I said, leadership team here, we're very serious about this. So we're not trying to have everyone, we have 20 staff total. Fortunately, we occupy 2 suites. So our essential program, the Rep Payee program, they're actually in a separate suite than we are, which kind of makes it easy for us to socially distance ourselves. But we don't want to have everyone show up in the office. So even now, if people need to make arrangements to come in to pick up supplies or things of that nature, because of course, when you're in the office, you have all of these things right at your reach, and then you work from home and you realize you don't know anything because it's all at the office. So we are kind of taking it by, you know, what's happening in the community, but also we've decided that probably as we do re-enter, we will do it on a staggered schedule. So we will probably have, you know, we may increase our admin staff coming in more frequently or longer. And then as counselors are comfortable and want to come in, still we won't be counseling in person. The counseling will still continue virtually or via telephone. But really the goal is we are still going to try and stay socially distanced. I don't know to what extent this will last. I don't think anybody really does. We know we've heard a lot of new cases, and my CEO is on it every day. She knows what the new cases are. And of course, with new cases, with more testing, obviously you're going to have more positive results, et cetera. But we're really just trying to make sure that we don't over inundate the office, and that we keep our distance from clients, and that we just continue to serve remotely as long as possible until we get to the point where we're able to come back into the office. We don't really have a date yet. Like I said, we kind of have the phase of what it would look like, kind of the same way that the state is reopening slowly in certain capacities, but we're pretty much still operating the same that we were in the initial stay-at-home order.
Sounds good. So our time is, we're coming to the end of our panel discussion, but I want to quickly ask you guys for your top 3 resources and tools to share with our audience. And you don't have to provide an explanation, just let us know what tools, resources, individuals that you've leaned on during this process. And you can go ahead and start this conversation off, Jermaine.
Oh, wow. Top 3 resources. We're so spread out in our community, man. It's obviously these virtual tools are probably all of our primary resource right now, because that's how we stay connected. Because we kind of, I'll say, stepped up and took the lead on a lot of the virtual webinars and Facebook Live presentations that merge these tools together, if you will. A lot of agencies have leaned on us as far as how to navigate these new virtual tools. As far as resources from throughout our community, man, our health system and our elected officials have really been dialed in with us. They've appeared with us oftentimes once a week to keep us updated, even the CEO of our health system. And for those that don't know, in Eastern North Carolina, where Greenville is, it's the home of the flagship hospital for a health system that actually serves 29 counties in the East. So our health system is a strong anchor for our community. And so we are constantly engaged in partnership work with our hospitals and health system CEO. And they've kept us up to date with the numbers, kept us updated with the cases and the threats and what type of equipment and materials folks need. And then I think the third piece I'll say is just being willing to restructure our offices. We've already gone in and restructured our office design to create that 6 feet distance because we were never able to 100% stop meeting with clients, but we did have to transition our offices in a sense to where you could come in and have that social distancing as well. So I would say those three things, staying connected with our local leadership, making sure we have the virtual tools, and then being able to be flexible in the way we kind of redesign our office setups.
Cool. Thank you for that, Jermaine. What about you, Liana?
Yeah, so I want to highlight three partners in the advocacy area, Legal Aid, the Center for Legal Advocacy, and the North Carolina Justice Center, who we've always had kind of close relationships with, but just have been working even more closely hand in hand over the last several weeks. And I think it speaks to what some of the other panelists commented on about how COVID-19 has highlighted and exacerbated many of the racial disparities in our community, both in terms of health and economic impacts. And so some of the issues that were issues before this crisis, like lack of affordable housing, low wages, lack of a public safety net, have just only come even more to the fore. And so that has, at the same time that we've been trying to address the immediate needs of the community, I think we've also felt called to really lean into the advocacy space and work closely with our local and state partners, not only in this sort of recovery process, but also to help address some of these disparities so that the next crisis won't hit these communities as badly.
Thanks, Liana. And so, Lisa?
So probably social media is huge. I was trying to do videos every now and then to let people know that we were still operating. That was a big barrier, is knowing what places are still open and what places are still able to function. Our collaborative partner network of other agencies, creative ways of marketing, Piedmont Triad Regional Council. We also helped partner with them in order to distribute masks amongst our senior population. So really just, the social media thing was big, and just I tried to get on everybody's Zoom call that I could get on so that I could let people know what we were doing, that we were still here, and just really just trying to network and get it out there so that we all knew what we were doing to try and serve our community.
Cool. Well, thank you guys for sharing that. And so we will quickly move into our question and answer segment, where we may have had some questions to come in through the Q&A. And so Denise, do you have some questions?
Yes, so earlier in our segment, good morning, everyone. Liana, you were speaking and Amy Marquez had a question, and her question was, when you referred to hotel evictions and the permanent hotel residents, that's when the question came in. You referred to North Carolina tenant law and evictions of certain segments who lived in hotels. So Amy's question was, how does this apply to those living in a homeless shelter's family house?
So I'm not a lawyer and don't know all the ins and outs of tenant landlord laws in North Carolina. What I have heard, though, is that, that definition of a primary residence is somewhat subjective and pretty broad. And so if it is the only place, when they're looking at determining whether you are covered under tenant landlord law, they're looking at, is that where you receive mail? How long have you been living there? Do you have any other addresses or residences that you've utilized? And so I think it's really determined by that definition of primary residence as to whether or not you would be covered under those laws, and therefore would be, also covered, would have to go through the court eviction process. But again, I'm not a lawyer. So if anyone on the phone knows the ins and outs, please feel free to correct.
Well, and I'd just like to add that this is me drawing information from the housing task force that had assembled here locally. The one thing I do recall is that many of our homeless shelter facilities and housing setups, they were housing more people than was probably safe for the social distancing required to deal with this. So many of them were forced to downsize their facilities and work with the larger housing networks to actually place people inside hotels and find alternative housing for folks. So I guess I'm using that to say that they didn't treat the homeless facilities in the same way, as in the sense to say everybody just stay there if you're already there. I know they did have to actually downsize in order to accomplish social distancing.
And I believe the HUD definition, but again, I'm not a lawyer, but I believe the HUD definition for homeless, and I know that for most of the time to receive homeless services, you have to reside in a shelter. For someone that may be couch hopping or living with family, as long as you are housed, even though it may be temporary or strained, I don't think you're considered homeless unless you were literally on the street or in a shelter so they can count the numbers. And a lot of times that's also what allows you to receive certain services. At least that's what it's like here in Forsyth County.
Sounds
Yeah,
good.
and I will just say one thing on the residents living in hotels was that it did, I think we as I mentioned, we'd already always known that there were lots of families in our community living in hotels and motels, but this really exposed the extent to which that was the case, and also that this was kind of a gap in our housing continuum. And that, to your point, Lisa, there's sort of like the homeless services network that serves people who are on the streets or in shelters. And then, our mission at Crisis Assistance Ministry was really focused on people with leases or mortgages. And the folks who were living in hotels were just sort of caught in the middle.
Yeah. So thank you guys for that. We had another conversation that was going on in our chat panel, and this was when we did the poll. Someone was explaining, when we questioned people on how they had their COVID-19 work plan, and there was a participant up there that works for a research organization, and she designs tools for financial education practitioners. And so she's interested in design appropriate tools that she can design or her organization can design that would that our panel would find helpful or useful, if there's any nuances or things that she should consider as she, I guess, revamps and pivots the way that she provides her tools and resources.
Man, I'll say that in a lot of the engagement that we did with community members, I will say the financial piece is a heavy piece, because you found that more community members were interested in how am I going to deal with my financial shortfalls, even more so than they were concerned with the actual COVID disease, right? In many cases. But my reluctance to even answer that is based off of, I think the problem that most people had was the delay in services. People could figure out how to apply for unemployment. They could figure out how to go through these different processes, but the processes were so deeply overburdened that I'm not sure what relief there could have been to speed those processes up.
Thank you for that, Jermaine.
Yeah, I would agree. I would think too that I know that we have seen a huge decline in service requests since the stay-at-home order was put into effect. And I think really since schools were canceled or schools were sent home or closed or what have you. And I think that a lot of that had to do with the fact that families had to figure out what in the world they were going to do. They didn't have time to plan, well, what's going to happen when my last paycheck comes? How am I going to go file for unemployment? I need to really go talk to a financial counselor, but now I have to figure out how I'm going to homeschool my child. And, lots of parents themselves may not be highly educated. I know some of the math problems that I've seen my nieces and nephews, oh no, we would have big problems if I had school-age kids in my house right now. So I think that a lot of people and families had to just stop and they had to figure out what they had to do immediately. And as always, and as we have always seen it in my industry and line of work, is the finances are usually the last, and they will figure it out when it's time to figure it out. Because right now they're trying to deal with so many other things that, you know, as they get to it, they'll get to it. And that's where I think we're in the calm before the storm, and that it is going to come. And so just trying to get creative, and we've utilized, fortunately, prior to all of this kind of happening, we were in the process of upgrading our software and our server. And so we are also implementing an e-signature capability, so that way, ironically, now, once we have that in place, that will also help make sure that we have certain documents signed that are necessary for file compliance. So sometimes thinking about those things is what makes it, what makes some things important to try and think of with regards to design of what your agency needs based on different accreditations or different, I can't think of the word now, that you're supposed to follow, different compliance that you're supposed to follow depending on the type of agency that you are. So those are also some other things that we've had to look at.
Sounds good. Sounds good.
Marquita, and if there, I also would like to kind of double back if I'm not being too obnoxious on it, but I think one of the things that I also saw that might be important here is understanding that finances for every family represents a different formula, right? It may not be just managing their check. It's if I'm foreseeing trouble with my utilities, right? How do I reach out to the utility company? And or if I'm foreseeing, right, an inability to pay my rent, who's the person in my city, if I don't have the organization that Charlotte has, that I reach out to engage with my landlord? And the one thing that I was continually driving home is that every household, well, there is no one size fits all solution, basket of solutions for every household. That every household would have to be proactive in putting together their own unique basket. And they would have to do that by reaching out to the specific agencies. And one of the things I find is that not many households knew how to do that, right? For us, there's a lady named Cassandra down at the city of Greenville that works with landlords and tenants to make sure that they are working on a proactive plan to keep people housed. But again, just realizing that the way households that are already dealing with distress, the way they manage their finances could be how they coordinate their relationships with the different agencies. And in that respect, every household is going to have some guidance and help in how to put together their own basket of relief services unique to their situation. And maybe having guidance on that for each area could probably be super beneficial.
So possibly a resource map included in some sort of financial, an emergency or a crisis resource map where someone could go and get information that would be updated and current when a crisis arises, and would also be, specific to locality. Maybe the resource map is broken down by county or city or something of that nature. So I think that's great feedback, and something that, I'm sure that the person that asked that question found that insightful. So thank you for that. Another comment that came up was organizations that are primarily served by volunteers, and because of this, the volunteers can't utilize the volunteers. Any thoughts or feedback or how have you guys managed that?
So I can speak to that a little bit, because the two other programs that we have, the Free Store and our Furniture Bank, are highly dependent on volunteers. We have volunteers contribute typically over 47,000 hours a year to the agency, and we cannot operate either of those two programs without volunteers. I mean, it's just we don't have the manpower to do it. And so unfortunately at this time both of those programs are suspended, and just because of the risks associated with, it's also not a volunteer opportunity that you can do virtually. It requires people to come to our agency and to help us sort donations and to help stock our free store. So we have, those are on hold for right now. And, we hope at some point to be able to reopen those programs. But the more urgent need in the community to us was the rent and utility assistance. And so, we hope that we'll be able to re-engage volunteers at a future point.
Okay, sounds good. Go ahead,
I'd
Jermaine.
add for volunteering that, and this is in regards to any services that were not kind of halted because of COVID-19. I would urge anyone to rethink this idea that you can't use your volunteers again for the appropriate services. I think most organizations have a volunteer training manual, and I think the idea is to start there, looking at what your protocols are and how to add in the trainings that might allow, again, for us, that no contact outreach method had to be added to somewhat of our volunteer orientation manuals, and shorten that so that as we leverage volunteers, because even if volunteers are working online, they're still volunteers, right? And never discount those social influencers and community influencers that are willing to spend time with your organization and commit to actions to help keep the ball rolling on certain things. But I think it's just a shift in how you train and activate those volunteers, and just rethinking the way we leverage people in our community.
Thank you. This is very insightful, and I know a lot of folks probably depend on volunteers, so this is good feedback. And so we have not had anyone raise their hand to provide any feedback from from our panelists, from our audience. So if anyone in our audience wanted to share best practices, we have a minute or so to do that. You can put it in the chat feature, or you can raise your hand. And in the essence of time, we will move. If something comes up, I'll bring it up. But thank you to our panelists for such rich conversation. We appreciate the insights that you shared with us and with our audience, and thank you for your work that you're doing and your commitment to the community. We really, really appreciate that. So I want to, if you could advance the slide. Thank you, Jada. So these are some of our upcoming webinars. We're having Homegrown Advocacy is going to focus on proud practitioners can advocate during a crisis. Capacity building for nonprofits will follow that webinar, and then virtual meetings at work, and they will highlight. We partnered with an organization, a communications organization, that's going to walk us through some communication techniques for people using virtual tools such as this, and really excited about that. And before we end this webinar, I want to give the panelists an opportunity to share any last minute things. And if not, we will let everyone go. So anyone have anything to share?
My final thought is, at this time and any time really, to be very fluid, be flexible, be patient, be tolerant, and think outside the box. And like I heard on another call, think about the needs of the community and not the way that you've done things in the past. You may have to change up your game a little bit.
Thanks, Lisa.
I think my parting thought would just be, and I've been experiencing this a little bit as working full-time from home with 2 kids who are trying to be homeschooled. For a lot of people right now, survival is the name of the game, right? And so surviving is my goal, not necessarily thriving. But I think also the other thing that makes me reflect on is just the importance of understanding where people are at, and those that there's a lot of trauma that people are experiencing right now in the community. And so just being mindful and sensitive to that in how we deliver services is critical.
Sounds good. Sounds good.
Marquita,
all right.
Marquita, they are asking if you could show the slide of the dates of the webinars with the dates, if you could go back to that one. Okay,
there we go. And so if there's did you have something, Jermaine, or you already signed off?
No, I didn't sign off. If I'll just echo, I really appreciate what Lisa was saying, just flexibility, and then just, depending on the size of the organization, everybody can't operate with the same amount of flexibility. But there was about a week where I was just sitting back rethinking, like, what are we doing? Are we really reaching everyone? And how can we, it's just, you have to question yourself and be honest with the way you're operating, and be open to your own personal critiques and critiques from those around you to figure out how you might be able to pivot. Because I think the biggest deal is understand that this is an extremely difficult time. You have people that were already in need of services, and then you have an entirely different set of people that are being thrust into need, while those that were already in need are being disconnected, and the amount of angst that is happening, and then with the dis and misinformation on top of that, even if you can see it clearly, understand that the average person cannot. So we just need to be sensitive and make sure that we are trying to see this work through the lens of the person with the least amount of access. And I would encourage everyone to just stay strong.
Yes. Well, thank
Very
you for
well
that.
said, Jermaine.
Yeah. Thank you all. Thank you, Lisa, Jermaine, and Liana, and Denise, and Jada, for your contributions to this webinar and all that you're doing for the communities that we serve.
Thank you, Marquita.
And thank you. And we'll end this webinar now. Thank you, guys.
Thank you. Y'all have a good
Thanks.
day.
Bye-bye.
Bye.